Thank you, Mr. Chairman. I seek recognition to strike the last word and speak on this bill. During the pandemic, many cancer patients were able to get their drugs mailed directly to them from their doctors, from their oncologists, but that flexibility ended when the public health emergency ended. So this legislation that we're voting on today simply extends this common sense policy so that independent physicians with on-site pharmacies can mail their patients their drugs instead of making them come in person to pick them up. I could stop right here, but I'm going to add some more things to this because more than anything else, I think this is common sense. But it's also important because about 15,000 independent oncologists in our country have on-site pharmacies as part of their practices. In my district, I have 3 independent oncologists with on-site pharmacies. Integrating pharmacies with a doctor's office may improve care for patients by reducing the wait times between diagnosis and treatment, improving patient monitoring, and enhancing medication adherence. For example, an in-house pharmacy can alert physicians to intervene when patients miss a prescription or if there's an issue with prior authorization. In-house pharmacies can also be more easily more easily provide shorter prescriptions than the typical 90-day prescriptions offered by the big chains. This is good for cancer treatments because of our cancer patients whose treatments change frequently in response to how they're improving. Independent oncology practices that prescribe and fill cancer drugs on site can also save patients and Medicare money. Last month, JAMA published an investigation by Harvard economists Dr. Kakani and Dr. Cutler that found that point-of-sale prices for high-cost drugs filled by in-house pharmacies was 1.76% lower than other pharmacies, which are mostly owned and controlled by PBMs. That should set some members of this committee off, since we're all on the same page on PBMs. On-site pharmacies saved an average of $800 for high-cost drugs per patient annually. Now, some of my colleagues oppose the bill because they're concerned that physicians will have the financial incentive to overprescribe if they're allowed to mail the drugs. But I think this concern really misses a few important good points. First, it's already legal for these doctors to refer their patients to their on-site pharmacy, so the financial incentive already exists. Second, if Medicare identifies overprescribing, then it has the authority from Congress to deny improper claims. My view is we shouldn't create barriers to care for Medicare beneficiaries, especially cancer patients, because of an unproven concern about potential overprescribing. This legislation will make sure cancer patients don't have to worry whether they'll be too sick to make the drive to their oncologist's office to pick up their drugs, which is a very good reason, I think, to vote for the legislation. So thank you, Mr. Chairman, and I yield back.